So, Doc, I think I finally figured out why I've been having so many emotional control issues over the past 15 months. Well, I had a dream, and in this dream, I went on a fishing trip and I caught one ginormous fish. It was like so huge and beautiful. And then I woke up. So later on that day, my grandmother came over and I decided to tell her about my dream. And then she told me, whenever people dream that they catch fish, it means they're pregnant. So that's what was wrong this whole time. I was pregnant. I mean, it would make complete sense. I've been so moody all the time for the past 15 months. I was pregnant this whole time. So weird. Hey everyone, thank you for stopping by my office today. If this is your first time here, welcome. If you've been here before, welcome back. Now lately I've been having so many questions about dreams. I don't know why, I don't know if it's just a strange coincidence, but I've been having a lot of questions and discussions about dreams as of late. So that's exactly what we're going to discuss today. Dreams. Before we begin this discussion, drop me a comment down below telling me one of the strangest dreams you've ever had, if you could remember. Something that you should note though before we go into this discussion is that the studies of dreams and sleep to an extent are very complex. This is because it's very difficult to be able to study the state of mind during sleep. So there's still so much research yet to be done in these fields. So what are dreams? Dreams can be described as stories or images that our brains create during a particular stage of sleep. We'll talk about the stage of sleep in a little bit. Now remember when I said just a minute ago or a few minutes ago that the studies of dreams and sleep are a bit mysterious because there's so many unanswered questions. Well, one of the unanswered questions that still remains is the reason or the true reason behind why we dream. Researchers have been debating for years over the true reason as to why we dream. But the general consensus is that dreams exist to help us solve problems in our lives, to help us process emotions or process thoughts or experiences that we would have had throughout the day. So, as I said before, our dreams occur during a particular stage of sleep. According to psychological studies, we undergo various stages of sleep during the night. So our dreams occur during the REM or rapid eye movement stage. This happens during this stage because this is when our brains are most active. So even though it is possible for us to have dreams during the other stages of sleep, the REM stage is where our most vivid and our longest dreams occur. It has also been determined that people dream at least 4 to 6 times per night. This would actually add up to about 5 to 6 years worth of dreams over the average person's general lifespan. Which brings us to our next question. Does everyone have dreams? Now this particular question is heavily debatable because I have a few friends who believe with all their hearts,
I wish with all my heart
that they do not dream. But believe it or not, everyone does dream during their sleep.
What? Bro, what are you talking about, man?
Well, I should say everyone except for persons who might have suffered from a particular type of brain injury. Otherwise, everyone dreams. However, the problem is that some persons do not remember their dreams when they wake up. As a matter of fact, about 95% of our dreams are actually forgotten by the time we get out of bed. Now, the reason as to why some people can recall their dreams while others cannot is yet another unsolved mystery to the researchers. Another question that is commonly asked or wondered is if blind people dream. And the answer to that is yes. Blind people do also have dreams. What? Now we need to remember that dreams are actually generated in the brain. So dreams are a function of the brain and not of the eyes. However, the timing of blindness in a person can affect the content of their dreams. According to research, persons who would have lost their sight, let's say around the age 5 or after, would still be able to have visual dreams. However, persons who were born blind or would have lost their sight before age 5 are more likely to experience their dreams through other senses such as taste, smell, touch, and hearing. Now, on to probably the most common question that we have about dreams. Do dreams have meanings? Similarly to the reason as to why we dream. This is yet another very debatable question in the field of research on sleep and dreams. While some scientists believe that dreams have absolutely no connection to our true thoughts and feelings, other scientists actually believe that dreams reflect our deepest desires, fears, and concerns, and that interpreting these dreams could actually give insight to our lives. Have you ever had a dream about being chased or losing your teeth or being naked in public or falling off a cliff or failing an exam? These are common dreams that most people have, and these types of dreams are actually believed to be caused by hidden stress or anxiety. Another common dream experience that many people have is recurring dreams, or basically having the same dream or a very similar dream repeatedly, night after night, or maybe not every night in a row, but you might have it last night and then you might have it 2 weeks from now, and then you might have it again next month, and then you might have it again the other month. You get the picture. Now, recurring dreams are actually known to be a sign of a lack of closure or resolve in some area of your life. Now, despite the fact that persons all over the world may be having similar dreams or common dreams, it is important to note that every dream would be unique to that particular individual. Now, I'm saying this because persons might have the tendency or the desire to go and research why they might be having a particular dream. No dream website or Google search might be able to tell you the true reason behind your dream. That is something that is personal and unique to you and you alone. So remember that. Now, as a Christian, I personally believe that some dreams do have meanings and messages. But what are your thoughts? Do you believe that dreams have meanings? Leave your comment down below in the comment section. Dreams can be cool and all. I mean, sometimes they can get a little weird. Okay, they can get a lot weird. But then sometimes they go to the other extreme of becoming scary. And we call those scary dreams nightmares. Now, nightmares, simply put, are dreams that are distressing and cause the dreamer to have a number of disturbing emotions such as fear and anxiety. Some of the main contributing factors of nightmares are stress, trauma, conflict, fear, and even the use of particular drugs and medications. But there are some other scary things that aren't entirely dream related that probably happen to you during sleep. For example, feeling as though you're falling as you're falling asleep and then jolting up and out of your doze. This experience is known as a hypnic jerk. Hypnic jerks are actually involuntary twitches or movements of one or more muscles as a person is transitioning from a state of wakefulness to sleep. The reason they happen is unclear. But these experiences are completely normal. They can be scary, but they are entirely normal. However, it is important to note that high caffeine intake, strenuous evening activities, and emotional stress can actually contribute to how frequently or how intensely you would experience hypnic jerks. Another very, very scary experience during sleep is waking up unable to move or speak and feeling like you're completely pinned down to your bed. This is known as sleep paralysis. Remember earlier we were talking about REM sleep. Now, during REM sleep is when sleep paralysis occurs. This is because during this stage of sleep, the muscles of the body are completely relaxed or practically paralyzed by the brain. Why does the brain paralyze our muscles? Simply because it wants to prevent a person from acting out and possibly injuring yourself during sleep. Thank the brain. So basically, sleep paralysis happens when a person has entered wakefulness in their mind. However, the body still remains in REM sleep. So you're awake, but your body is still in REM sleep and the muscles are practically still relaxed or paralyzed. Sometimes sleep paralysis can last for up to 10 minutes and it can be absolutely frightening. I know, I've experienced it. Not nice. But it's completely normal, so you don't have to worry about it being some sort of underlying medical condition or anything like that. It's completely normal. And that's it for our discussion on dreams and sleep. Thank you so much for tuning in once again. Please hit the subscribe button. You can also feel free to check out Mental Health Matters on Instagram, where you'd be able to find more information on dreams and sleep, as well as other mental health related issues. And please remember to become informed on the matters of mental health, because your mental health matters.